London.
Neil from London Hems. It's a 25-year-old male, cyclist versus HGV. His code red, and ETA via air to the pad is 15 minutes.
What have we got coming? So London Hems are bringing us a 25-year-old male, cyclist versus HGV, code red. Okay, and where do you want to put him? Put him in Bay 8. Okay, yeah. And how long have you got? 15? 15 to the helipad. Should we put the call out now? Yeah. Okay, great, thanks Nick. Through the pre-arrival checklist. Yes. Okay, so nurse in charge contacted you, consultant informed me. Have we requested trauma pack? Yeah, it's on its way. ICU consultant has been informed it's coming. Ultrasound is switched on. Bloods and imaging are being requested now. Yeah. Trauma line is set up. Yeah. Trauma consultant contacted through switch. That's been done. Yeah. Radiologist has been informed and is coming down. 12:20 and theatre coordinator informed. Yeah, and theatre 12 will be ready if we need it. Brilliant. Transfusion PACO requested. Yeah. And we've declared code red. Yeah. Okay, fantastic. So everyone will be here in a minute hopefully. Okay, thanks.
I've just come back from Amsterdam. It's the Diamond Museum. David and I got slightly scared about how much it's actually going to cost, so we think we might go things. To be fair, we've got no cash. We're doing at his house, I'm doing at mine, and we've just not got so we're going to have a bun fight in a church hall, and well, we're not officially rich yet, but it's going to be that thing where we talk.
Guys, just before the patient arrives, could everybody just state their first name and their role? We'll go round to my left. So I'm Anne, A&E consultant team leader.
Vish, orthopedic registrar.
Sarah, radiographer.
Mariam, surgical registrar.
Will, ED registrar.
Javaria, radiology registrar. Queenie, ITU registrar.
Harriet, primary nurse.
Babe, Belmont nurse.
Heidi, orthopedic SHO.
Nick, surgical SHO.
Pretty theatre nurse.
Karen, theatre nurse.
Brenda, EDA assistant.
Nikki, nurse in charge of recess.
Okay, has everybody had a chance to read the action card? Most of you have set up your equipment. Is there anything missing that you need to be able to perform your role? Okay, good. So the story is, this is a patient coming in with London's Air Ambulance, 25-year-old male, pedal cyclist hit by HGV. They've declared a code red and they've already given at least 1 unit of packed red blood cells. So I think we've got everything out that we need, but the plan will be to do the primary survey, immediate chest and pelvic films and a fast. We'll then make a decision based on stability about whether we can go directly to theatre or whether we have a window to go to CT. Queen, are you happy with the airway? Okay, thanks Neil. Ready for handover?
Alright, good morning all. This is Matt. He's a 25-year-old male. Approximately 1 hour ago, he was a cyclist versus HGV. He was GCS 15 on scene, moving all limbs. Injuries head to toe, no concerns with the head and the chest. Significant bruising over the abdomen and a closed open book pelvic fracture. Interventions, he's had a 111 RSI with a rock time of 9:56. And he's had 1 gram of tranexamic acid. He's had ongoing volume issues. He's had 2 units of blood en route, and his last systolic blood pressure with us was 85.
Okay, that's great. Thanks, Neil. Okay, guys, can we have 3 people either side? Trolley perhaps down a little bit and both sides down. So we're going to lift him. Okay, we're going to lift the scoop about 6 inches on Queenie's count, and Vish will pull out the blizzard blanket.
Okay, brakes are on my count. Ready, brace, lift. And ready, brace down.
Okay,
thank you.
Can we have head oximeter off, scoop broken top and bottom, please.
Broken at the top.
Broken at the bottom.
So bracing can take the left button and no rolling. Thank you. Okay. Queenie, you happy with the airway?
I am happy with the airway.
Okay, on your count.
Okay, so ready, brace, pull. Thank you.
No rolls down.
And ready, brace, pull. Thank you.
Okay, can we have primary survey and blood taken, please?
Yeah. Okay. Queenie, you happy with the airway?
I'm happy.
Oxygen ventilation?
Yes, I am.
Temperature 35.
The trachea is central. There's no obvious chest injury. No surgical emphysema. Chest expansion is symmetrical. Percussion's resonant bilaterally. Harry. Good breath sounds bilaterally. He has obvious bruising on his anterior abdominal wall, extending in both flanks and also in the lower aspect. The abdomen is otherwise soft. He has a pelvic binder which is at the right level. Good femoral pulses bilaterally.
Cut the end of them.
Okay, can I see those? I've got a gas and I'll run it now. Thanks, There's some obvious bruising on anterior
just leave
aspect
it
of
as
both legs, more so on the right thigh and also the right leg. And also on the left knee. No obvious bony injuries. The pupils are equal and reactive. Has no obvious bleeding from the external auditory meatus.
Guys, at the moment we've got a tachy of 120, we've got an end tidal of 3.7, a blood pressure of 85, so we don't need any more blood at the moment.
Okay, good blood taking, well done. That's great. Can we run that gas, please?
Has a here for chest X-ray, please. In 5, 4, 3, 2, 1. Thank you.
Okay, that's great. Guys, at the moment, he's got a blood pressure of 84, his end tidal is 4, and we've got a heart rate of 100. So I think we're probably in a situation, unless the fast is positive, that we can probably go to CT. So if we can get prepped for that, we'll get the fast done. And Nemi, you have to pop a central line in, please. Thanks.
Okay, I'm performing the fast scan. So looking in the right upper quadrant, no free fluid. I'm now looking in the left upper quadrant, no free fluid. I'm looking down in the pelvis. I can't see any free fluid yourself. And I can't see any hemopericardium. Okay, so in summary, this is a negative fast scan.
Thank you. Okay, the chest X-ray, tube's in an adequate position, and on the left side of the chest we have rib fractures and a pneumothorax. So, Nick, would you prep to put a chest drain in, please, just before we go to CT? We've got a couple of minutes. Mariam, you happy to support him? Yeah. Thank you.
Hands clear for pelvis. 5, 4, 3, 2, 1. Thank you.
Okay, that looks like a complex right-sided pelvic fracture.
Okay, so that's great. Thanks, both. Are you happy if we do CT head to pelvis? I think that's probably okay for now. And if we might need IR, so can you just let the interventional radiology team know? Is that right? Thanks. That's great.
Okay, guys, we're ready to go to CT. Everyone happy to move?
Yes.
Yeah.
Breaks off.
So we're going to log roll him 10 degrees gently on my count. Ready, brace, roll. Thank you. And onto the blue. Ready, brace, slide. And on the blue, ready, brace, slide. Thank you very much.
Okay, let's just check what enough leg.
So his blood pressure's dropping off a little bit.
Yeah, he's become more tachycardic. Okay, BP 70.
Let's head and see spine done. We can go back in if we need to.
Okay, guys, I think we should give him 250 mils of packed cells to start with, and we've got the plasma up, so the second bolus will be plasma if we need to give it. But can we start with that? Is that okay, Queenie? Yeah. Thanks. Okay, let's just carry on and do the body scan though, so that we get a diagnosis and we decide where we're going to go, but we'll transfuse him whilst we're waiting. Yeah.
There's hemoperineum, particularly on the right-hand side, and also blood related to the complex pelvic fracture that we've seen on X-ray, which is right-sided, involving the acetabulum and the ilium.
Quite nasty.
It looks like a nasty fracture, and the remaining solid viscera are normal in appearance.
Hemodynamics then?
They're about his systolic of about 90 when he came in, having had 2 units of blood with HEMS, but he's just dropped his blood pressure just after we did the CT head, so he's having PAC A at the moment, so he's had another further packed red cell and a unit of plasma as well, so he's less stable than he was.
Great. Well,
And he's got a lactate of 3.6 and a base deficit of -8, and that's before he dropped his blood pressure.
so yeah, given these findings that you're showing us here, I think probably the next best step is to go to a theatre. You can do pre-peritoneal packing and do an X-lap too.
And we've got a pack B on order.
Yeah. Okay.
And we're going to theatre 12.
Okay, great. Thanks, Rosanna. Okay, so we'll just go through the exit checklist before we depart. So we are going to go to theatre 12. Do they know we're coming? Yes. Okay. The planned procedure is pre-peritoneal packing and exploratory laparotomy.
Yes.
We'll just go through the checklist. So name bands times 2. Yeah. Oxygen supply connected to the patient and tank sufficient.
Correct. Yeah.
Airway secure.
Yes, it is.
Breathing and ventilation adequate.
Yes, it is.
IV access well secured.
Yeah.
We've got blood products, pack A, and the real-time log.
Yeah.
Monitor is attached. We've got
Yeah.
the transfer bag,
Yes.
suction unit on the trolley,
Yeah.
emergency drugs.
Yes.
Do we need any special kit? No. Transfusion, have we told them that we're going to this as well?
Yeah, they know that we're going to
Great, have we got the priority 1 card for the lift?
Yeah.
And the porters have gone ahead to get the doors?
Yeah.
Brilliant, okay, we're ready to go. Again, if the whole team can come, we'll hand over in theatre.
Yeah.
Thanks everyone.